Sunday marks 15 years since the September 11th attacks. Even today, the number of victims continues to rise. More than 5,000 cases of cancer have been linked to the toxic dust workers encountered in Lower Manhattan after the attacks. Jim Axelrod shows us one of the heroes who is now fighting for his life. Jim, good morning.
Good morning. As an EMT with the New York Fire Department, Sal Turturici spent months after the attacks working at Ground Zero during the recovery effort. Every September 11th since, he's paused to remember others, keeping them in his prayers. Now, in a cruel twist, Sal is no longer the one providing the prayers. He's the one who needs them.
This is what really changed your life.
Yes.
This is it.
The diagnosis came last October. The sudden pain in Sal Turturici's stomach? Cancer, the doctor said, attacking several organs at once.
They said that the cancer was in here for approximately 7 years. And I can't believe it.
7 years.
7 years it's been in him. Not a pain.
Yeah, I didn't have any kind
nothing.
Any kind of sign or symptom. I didn't have
nothing.
Anything.
After multiple surgeries, doctors are now telling this father of three there is little they can do.
I want to be there for them. I want to walk my daughter down the aisle. I want to see my boys graduate college. I want to see this all happen, and I'm not sure I'm going to get there.
The federal government's World Trade Center health program has linked Turturici's condition to the toxins he faced at Ground Zero. He joins a growing list of responders who've fallen ill long after the attacks.
As you began to see people get sick, were you worried about yourself?
No.
Why not?
I just didn't have any idea I would think it. I didn't even think about it. Didn't even think about it.
Thank you.
Thank you. Dr. Michael Crane has given it plenty of thought. He runs the 9/11 Health Program Clinic at Mount Sinai Hospital in New York. Sal's story, you anticipate being told more and more and more in the upcoming years.
I want to say no, but the answer is yes.
Among the nearly 75,000 responders and survivors health officials are monitoring, they've certified more than 5,400 patients with 9/11-related cancers. And Dr. Crane says the numbers continue to rise.
Here at Sinai, we see 10 to 15 new cancer patients in our population every week.
10 to 15 cases of first responders?
Per week.
Each week?
Each week. I've been in medicine for 40-odd years. It's remarkable.
Mirna A. Duarte.
Responders who died from illnesses after the attacks are not among those listed at the National September 11th Memorial. But a former Ground Zero construction worker is keeping track at his own memorial, 45 miles away.
We're 15 years removed from 9/11. We are out of sight, out of mind.
John Field adds new names every year to this wall on Long Island.
Sal, like the others, was a warrior and still is. And he's fighting the good fight. And listen, we're hoping for a miracle, but reality dictates that Sal Turturici goes on this wall.
Come do your tomatoes with Dad.
Reality is sinking in here on Staten Island, where these parents say they're doing what they can while they can to make memories for their children.
Don't forget about us. Don't forget about the families that are out there.
Remember. You got to remember.
Remember what, Sal?
Remember that this is what happened. This is the history. This is our legacy. They died, and we're dying, and hopefully that, that you think about us and remember us and keep us in your prayers.
Early studies have found 9/11 responders may have about a 10 to 30% higher risk of cancer than the general population, but doctors say there is still a lot of research that needs to be done to understand exactly why this is happening. Late last year, lawmakers passed a measure to spend more than $8 billion to extend health and compensation benefits to 9/11 survivors and responders.
That's the least we can do.
It is the least we can do is remember. Can you imagine if you're a first responder sitting, listening, and watching that piece, and that 15 years later, we are all still feeling the effects, some, as you see, worse than others.
Living with the cancer, not even knowing it for 7 years.
With no symptoms.
Yeah.
No, we'll never forget.
It's important to remember the first responders, our veterans.
Yes.
The care for them extends long beyond just the conflict or the day that they're involved in that because of the very hard and difficult work that they do.
Very painful piece. Thank you, Jim Axelrod.